Le cellule CAR-T, una forma di immunoterapia cellulare che ha cambiato la storia del trattamento di alcuni tipi di linfomi e leucemie, sono protagoniste di un evento in corso a Milano organizzato da Kite Gilead, una 2 giorni nella quale si fa il punto su vari aspetti legati al trattamento con queste cellule geneticamente modificate. Noi abbiamo colto l'occasione per parlare dell'impegno di Kite Gilead in questo settore con Dominique Tonelli, Executive Director dei Medical Affairs di Kite Gilead. Dr. Tonelli, first of all, which is the commitment of Kite Gilead in the treatment of blood cancers?
So Kite is a company that is focused on cell therapy. Our ambition is to help patients with hematologic disease and potentially cure cancer. We are dedicated to improve the way patients are being treated and potentially offer them promise of cure. Currently, in fact, we have seen recently the results of one of our trials that has compared standard of care with salvage therapy and transplant to Yescarta, our product, and showing an improvement in the survival benefit for the patients treated with Yescarta. This is a game changer, and the standard of care, that is salvage chemotherapy, followed by autologous stem cell transplant that has been established more than 30 years ago, has now been beaten with the CAR T cell therapy.
Kite Gilead has been a pioneer in the development of CAR T cells. Several CAR T cells are already approved and in use, but which are the most important studies that are still ongoing on CAR T cells at Kite Gilead?
So the development has run extremely quickly over the last 10 years, but currently there are still a number of trials that are ongoing and about to start. I think it is very important maybe to emphasize two of them, which are two randomized phase 3 trials, meaning trials comparing a CAR T to another standard regimen. The first one is the trial named ZUMA-23. It is in first line large B-cell lymphoma that are at high risk of progressive disease. The second is in follicular lymphoma in the second-line setting, also comparing to a standard arm. Those two trials are really extremely pivotal trials that will help understand how CAR T can improve the life of patients with lymphoma and with follicular lymphoma.
Are there other autologous CAR T cells in development in Kite Gilead pipeline?
Absolutely. Yescarta and Tecartus have made dramatic progresses and help a lot of patients. However, we know that it's not perfect and there are many things that need to be done in order to improve. We do have a pipeline where we evaluate and assess a number of different CAR T therapies beyond the CD19. We have combinations such as CD19 and CD20, and we have also in partnership with Arcelix a new target for multiple myeloma, which is a DDBCMA.
Allogenic CAR T cells are a hot topic in oncology and oncoematology. Are there allogenic CAR T cells in development in your pipeline?
Absolutely. We do also have allogenic CAR T cell in development in the pipeline. Allogenic CAR T cells make a lot of sense, but it makes sense if we are not able to improve our manufacturing and expedite the time to make the product available for patients. The manufacturing process is also an important component of the research of Kite to improve and accelerate the way we provide treatment to patients.